Okay, good afternoon. Welcome, everyone. I'm Lisa Maynard. I am an implementation specialist with the Center for Adoption Support and Education. We're based in Burtonsville, Maryland. I'm coming to you today from New York State. I'm here with my colleague, Edna Davis-Brown, also an implementation specialist with the Center for Adoption Support and Education. And joining us is Bonnie Goodwin, the program manager for the University of Oklahoma's Center for Child Welfare Training and Simulation. I noticed from our chat box, we've got lots of people here from the state of Mississippi. That's really exciting, and welcome to you all. And if you have not yet indicated where you're calling from in the chat box, if you would do that, that'd be really helpful for us so that we know who's on the line. Remember that when you input into the chat box, you select to everyone so that we can all see who's calling in. Okay, so we're ready to get started. And again, welcome to you, and thank you for joining us in this kind of crazy climate we're in this period. And hopefully you're all home safe and healthy and ready to go. So I'm really excited that we've got online learning that you can implement in your state today if you're interested, and hopefully you will be after this call. So in this webinar, we're going to briefly give you an overview of NTI, the National Adoption Competency Mental Health Training Initiative. If you don't already know about it, we'll just give you a real quick outline. We're going to talk about transfer of learning. That's what the focus of this webinar is today, and tell you what it is and why it's important. Bonnie from Oklahoma is going to share her agency's experience in working with NTI and how they implemented transfer of learning to enhance practice and bring it into day-to-day. And then we'll talk about some additional strategies to enhance transfer of learning and tools that we have available on our website to assist you with that. And then at the end, we'll follow up with some questions and answers and see what it is that you need in order to get going. So just very briefly, NTI consists of two web-based, self-paced trainings, one for child welfare and one for mental health professionals. The child welfare training has additional modules for supervisors. The curricula are not identical, however, they are aligned and complementary. They include two modules focusing on clinical issues and interventions, assessment, treatment planning, and parenting strategies. We had about 21 national advisors and partners with that helped to create the NTI. We're really thankful that they all were on board and helped us to bring the best practices and most up-to-date research together to identify the core competencies to create webinars and training that provides knowledge, values, and skills needed for adoption and mental health competent child welfare practice. You'll learn more about our core competencies from our website, www.adoptionsupport.org/NTI. So as I said, the training consists of two web-based self-paced trainings. This just gives you a really brief overview of that. All of these slides are available on our website, and real detailed information on both trainings, including goals and outcomes, are available on our website. So you can go there to find those specific details as well, learning objectives and so on. Through the NTI web-based trainings, we endeavored to support a common core of mental health and adoption learning that will enhance the ability of child welfare and mental health professionals to speak a shared language and to collaborate to better serve adopted children and their forever families. We've worked to support this collaboration between child welfare and mental health to improve permanency outcomes and the health and well-being of children and families. And we have worked across the U.S. in our pilots to really bring the two entities together.
Thanks, Lisa. Let's now talk about what is this? What is transfer of learning? The transfer of learning process is an interrelated series of tasks performed by supervisors, trainers, learners, co-workers, and sometimes others, for example, government regulators, clients, etc. And it takes place before, during, and after a learning intervention in order to maximize transfer of knowledge and skills and promote and improve job performance. Let's connect the dots. Next slide. Training, of course, we know it can be costly, requiring a significant investment of resources. However, NTI is free, yet the investment of staff time is significant. It's important to maximize that investment by supporting day-to-day practice change. Think about your goal for training. Improve practice skills, serve children and families more effectively. Staff want to feel equipped and perform well at their jobs. Learning interventions are resource heavy. Let's talk about what we know. Look at these findings. The idea that learners lose 70% of what they learn in the first 24 hours is astounding. For neuroscientists, probably not so astounding. They understand that brain is doing what it is designed to do. It's pruning and getting rid of information that's not critical so it can save information that is. That's right, our brains are designed to get rid of information. While that is frustrating from a training perspective, it is understandable from a brain perspective. We would not want the memory of what someone ate for breakfast on Tuesday to be as important as where the fire extinguisher is in their home. So the brain picks and chooses what it hangs on to. It is an adaptable and even desirable process. Does this look familiar? Without attention, intention, and support, this is what staff experience upon the completion of a training. This approach will never produce the results we want, will it? We all have participated in trainings that do not produce the outcomes that were intended. There are many reasons for this. Here's just a few. The time frame for learning is viewed as the time it takes for training and not all the time for planning as well as reinforcement of knowledge and skills. We need to shift the time perspective with training. There is not a direct link often to support the transfer in the job environment, and that's really critical in terms of learning transfer, really focusing on what's needed to put things into practice. And here you'll see a number of reasons. Let's look at 6 key principles. Learning can't be achieved in an in a one-off event. There's a limit to what that can be learned in a webinar or a 20-hour e-learning module or even a multi-day workshop. So what's missing? For one thing, the hours and hours of practice needed to incorporate what was learned into everyday action and to develop proficiency. The second thing is that all the coaching and reinforcement needed to keep the learner on track and using what was learned. So coaching and reinforcement is really important. The vast storehouse of information, facts, figures, and theories may help you pass the test or make you a great game show contestant, but it doesn't guarantee that you will be able to apply the knowledge on the job. Too often, training focuses on knowledge acquisition, and it just stops right there. So I'd like to transition now to Bonnie Goodwin, who is the program manager with the University of Oklahoma Center for Child Welfare Training and Simulation. She represents one of our pilot sites who will really speak to her experiences around learning transfer with NTI. Bonnie?
Hello, and greetings from Oklahoma. First, express how thankful we are for the opportunity Oklahoma had early on with the NTI training. We actually jumped on the pilot phase for the training a bit late after I heard NTI staff share about the training at the 2016 NACAC annual conference in Nashville, Tennessee. After hearing this, I was so excited with the information. I approached Don Wilson with NTI and asked if there was any way that Oklahoma could still be involved after the pilot sites had already been identified. Miraculously, in the next few months, in Oklahoma, and we jumped on the opportunity. NTI staff said to share about the training to our OK DHS leadership and community, and we quickly formed a state implementation team by the end of that. The SIT, on the next slide, there you go. The SIT team met monthly to discuss the rollout training. We had executive leaders from DHS, as well as several field supervisors, training supervisors, and community leaders from supporting agencies. One of our SIT team members, Robin Gibson, is the field supervisor of the Adoption Transition Unit. That unit is a specialized unit created to work directly with children for adoption, but did not yet have an identified family. When we're into the NTI training, she shared with the rest of the SIT team that she she said it was actually like binge watching. Like it was so interesting and foundational for her, and she decided that her entire unit needed to have all of the information. So with this incredible buy-in, it was easy for DHS executive leaders to make the decision to require all foster and adoption supervisors and specialists to complete the NTI training. They designated protected time to allow all specialists to be able to complete the online modules in a predetermined schedule. Additionally, this is my favorite part, the SIT team decided to add a transfer of learning component in which coaches would meet with specific units at the end of each module to discuss the material more in depth. So immediately, Robin, with her incredible buy-in with the training itself, volunteered the entire ATU unit to participate in the coaching sessions. There was also one unit in the permanency division that was required to complete the training and participate in the transfer of learning coaching. The ATU specialists spread out all across the state. So how we provided these for them, we're setting up online Zoom meetings where they could join in from wherever they were located to participate. The permanency unit was centrally located in Oklahoma. So then I was able to meet with them every 2 weeks in person. I myself served as one of the transfer learning coaches, colleagues and friends. Dr. Carissa Wilsey, who's a clinical child Center for Child Abuse and Neglect here in Oklahoma, and Leslie Keenan is a clinical social worker who is focused on providing excellent mental health services for adopted children through a nonprofit agency in Tulsa. I and was leading a similar nonprofit effort in Oklahoma City. We were chosen to serve as coaches due to our clinical expertise, the specific knowledge and experience on adoption and foster care, and being in positions of leadership. It was particularly important to our SIT team to have mental health coaching for the child welfare staff to bridge the gap between the two disciplines. Far too often, child welfare specialists don't feel confident feelings about children on their caseload directly to mental health professionals because of a sense of that they are not as trained as the therapist or counselor. To empower the specialists to feel confident to speak up as they know the children they're serving and can be a powerful advocate for them and their foster families in receiving the best mental health care available. Also, we wanted to standardize these coaching sessions to determine and deepening the transfer of learning for the specialists, since we weren't able to provide for every single specialist taking the NTI training at this time. So was by creating a PowerPoint for each module, reviewing objectives, and then highlighting the additional resources provided. In my in-person sessions, I would bring printed copies of each of these resources to discuss. Online sessions, the coaches emailed the participant before the session was scheduled so they could print them off and have them in hand to go through during the coaching session. Each transfer of learning coaching session lasted from 1 to 2.5. Longer sessions were typically because a few specialists or supervisors would hang around at the end of the session to discuss how to incorporate the module's information with specific cases on their caseload. This, according to the participants, was the most beneficial aspect of the transfer of learning coaching. In every session, I had at least 2 specialists who brought specific questions from their cases. For example, one specialist shared with me several questions she had a case who was to be working toward reunification with her father. She involving the foster parent in therapy sessions recently and wanted to explore options of how to suggest including the father in sessions. I was able to share some specific language with her to empower her to have this conversation with the therapist directly and encourage her that this would be a good option to explore due to the goal of the case. I wanted to share with you have these specific groups participate in the transfer of learning coaching sessions. The rest of the foster and adopt division took the NTI training without coaching. We were able to evaluate the differences in the training experience. Or did the coaching for these specialists? That's what we wanted to find out. The answer, yes. There was significant evidence that showed these consistent and purposeful did in fact increase the significance and value of the NTI training for these. Specifically, they reported higher levels of completion of all, greater improvements in knowledge and practice. If you'd like to read more about these, you can find this peer-reviewed article in the Journal of Public Child Welfare. So that is an overview of how we were able to and do some specific in-depth transfer of learning. Love to answer any questions on the chat. Yes,
yeah, Bonnie, why don't you go ahead and...
Yeah. Sorry, Lisa. Go ahead and answer that question.
I was going to start. I'm sorry. Yeah, go ahead and answer the question about who you trained and how.
Yeah, sure. We did train all of staff. So that one division, every single specialist did the training. And then there was just one unit within the permanency division that did the training. So not all of yet, but now after these outcomes, seeing that not only did the transfer of learning coaching help, but then also how the whole training helped the foster and adopt division. Now we are expanding the training to the rest of the child welfare staff.
Great. If there are any other questions for Bonnie, we can answer them now, or you could also ask them at the end of the session if you like. Thank you, Bonnie. That's just so interesting to hear and so exciting. I just love how transfer of learning was implemented in Oklahoma, all the great work you did, and really the impact that it made. I also love that you folks use that time to kind of hang around and talk about case-specific instances. And it sounds like that was really valuable for your staff and your supervisors as well.
Absolutely.
Great. Okay, so just thinking about what we've talked about so far, how can you use this information and what could you do to build your plan when you're implementing NTI in your state? We hope that you'll start by thinking through these simple steps. Who's involved in the transfer of learning? When does it take place? What is involved? So how are you going to do it? Are you going to do it as Bonnie talked about, in Zoom sessions or some other kind of virtual learning, in person, maybe a combination? And then how do you make it happen? Who are the players that you need on board to make sure that this takes place? I think, Bonnie, you sort of talked about having someone who's really committed to the transfer of learning process and on board and making that happen. What elements will your plan include, and then how will it get implemented? So we want to talk about, how do you fill up your toolbox? What is it that you need, and what are some of the steps to take? Well, we're going to take real discrete steps that are realistic, measurable, and attainable. Bonnie talked about having 2 different groups of learners who participated in this, and I think that that was really a real good goal, because we were able to see the difference between those who had the coaching and those who did not, and really how much of a difference that made. Make sure that you identify clear responsibilities for everyone. So who does the work and how does it get done, and what are the time frames? Would be really, really important. And then identify any resources that you might need to complete the activities. Who does the printing? Who brings the, I mean, as simple as who schedules the room time or the Zoom time in order to have these take place. So write activities that are as discrete as possible, and develop a specific time schedule for completing the activities. You might also instruct learners to keep a learning journal, sort of writing down any questions that they might have, or ideas, concepts that they're questioning, so that when it comes to the supervision and the coaching session, they have some things to talk about. Some of our pilot sites use this transfer of learning matrix. One of the things that we've learned is the most powerful factor in promoting transfer of learning is what the supervisor does before the training even occurs. We assume that the supervisors have done the training first. It's really helpful for them to be a little bit ahead of the curve in training, so that they are able to talk through some of the details. And then what the supervisor does after the training is really critically important in supporting that transfer of learning. On our NTI website, we've got lots of tools for you to use, lots of resources. The tip sheets are really a great resource. That they go along with each module and make suggestions about how to use them in supervision. Lots of practical ideas and resources, and they're all available for download. You could print them, hand them out, or send links, whatever is your preferred method of sharing this information. And they're on our website, and you can see that here. And again, Gary, if you wouldn't mind putting that into the chat box, we'd really appreciate that. At NTI, we've also created a supervisor coaching and activity guide. This is also posted to our website, and the link is going to be dropped down into the chat box as well. This again gives you step-by-step guidance in doing some supervisor coaching and activities with your staff to support that transfer of learning. Some real specific suggestions. I think this coaching and activity guide is about 20 pages long. It's a really great resource. Go ahead and take a look at it. I think you'll find it really useful. This is a slide of our upcoming webinars. We have two left on this series. May 14th, What I Don't Know Can Hurt Kids and Families. This is specifically for mental health professionals. Again, we want to bridge that gap and create a shared language between child welfare and mental health professionals. And we're hoping that we can get a lot of clinical staff and private practitioners to participate in the webinar so they can understand why it's important to have some adoption competency. Oftentimes, clinicians who are working in private practice think that they know how to talk about adoption, foster care, and often they really just do not have an adequate background to do so. So we're hoping to increase their capacity as well. And then on June 23rd, we're going to talk about coaching and supervision for child welfare.
Great. Thank you, Lisa, for sharing those upcoming webinars. I wanted to specifically reinforce some things because I see that there are quite a number of people from Mississippi, so I'm giving Mississippi a warm shout out, given that I've worked directly with lots of folks there. We had mentioned the fact sheets earlier in the discussion. These are great to use in terms of transfer of learning. They actually have activities that are directly connected to the modules in the training. For example, I just want to give an example. For example, if you have staff who have completed, say, modules 1 and 2, and you may want to do some learning transfer type activities in one of your staff meetings or case management meetings or whatever the case might be, you can use these fact sheets to actually do some transfer of learning activities with your staff. It also addresses activities that supervisors can really do one-on-one with staff who have completed NTI training. I can't emphasize enough how those fact sheets will be really useful in transfer of learning activities. So I just wanted to share that. If you would turn to the next, if you turn to the next slide, Lisa. We've had the great fortune of receiving funding for outreach, implementation, integration into additional states, tribes, and territories through September 2020. If there are folks on the call who have not engaged directly in terms of getting NTI in your state, or if you have contacts in other states you think might be interested, please contact NTI. You can actually use my email address, davis_brown@adoptionsupport.org. If you have someone in your network that might be interested in the training. So let's now, we've talked quite a bit, and certainly we want to ask or answer additional questions that you might have in terms of transfer of learning, or if you have any questions regarding implementation. What do you need to implement NTI in your state or agency? Or what questions do you have specifically about transfer of learning? Are there any questions that we have that I may have missed in the chat box? If you'd like to put those in as well, feel free. One of the things some of the questions we get around the training is sort of timing in terms of the time frame for staff to complete NTI, and certainly with some states, they have put a policy in place that their staff are to complete the training within 3 months, others 4 months, whereas some have said each month staff are to complete at least 2 modules. They are required to complete 2 modules per month. So it depends upon your organization and how you want to roll out the training. But we strongly recommend that at least within 4 to 6 months, hopefully a little bit sooner, that you have your staff complete the training, because timing is really important. And furthermore, you really want your staff to be practicing what they're learning in the training, practicing some of the skills, because the training is loaded, and I say that very emphatically, loaded with so many resource materials, fact sheets, videos, things that you can certainly use with your clients and also use to educate and reinforce learning.
Another question we often get is about CEUs. And we do have NASW approved CEUs for the training, both for the child welfare and mental health trainings. If NTI is accessed through the case learning management system, the CEUs are free. Some states have chosen to upload the NTI trainings into their learning management systems, and then it would be up to that system about how to provide those CEUs. And CEUs are also available through the CapLearn. If taken through CapLearn, they're available through Cassidy Seminars, and there is a fee through Cassidy Seminars of $40. Those CEUs that are obtained through Cassidy Seminars are available for multiple disciplines, not just specifically social workers.
Another question that comes up, especially when we're at national conferences, some of you may have seen us at national conferences that are exhibit table and also presenting. Oftentimes the question is raised, can foster or adoptive parents take NTI? The training is specifically designed for professionals. And of course, as we know, some of our professionals are adoptive parents, but it is specifically designed for professionals and mental health providers. But the information, the resource tools embedded within the training can certainly be used with your parents. As a matter of fact, we strongly encourage that because they were designed, some of them with that in mind. So I just wanted to reiterate that we hope ultimately we'll be creating something for our parents as well, because that's really, really needed. So there's a question. We are trying to build this into helping support our state adoption call to action plans to make progress towards better permanency timeliness. Are there other states doing the same? We would be interested in any data from states already implementing NTI if they can conclude this. I'm not probably reading that correctly, but Olivia Biggs is asking that question.
So let me jump in here and say that we do have data from our pilots, and all of that data can be found on our website. Hi, Olivia. Glad you're on the call. We do have states that have been using NTI to build on some of their permanency plans. I can think of a couple offhand. We'd be happy to connect you with some of our pilot sites so you could talk directly with them. I know that the folks that I've worked with in all of my pilot sites would be happy to share specific information with you. But again, if you go to our website, we have all the evaluation data listed on our website.
And Lisa, what we may want to do, if there are specific states or contacts that we can put Olivia directly in contact with, we can do that as well, because she may want to ask some specific questions as well. So we're open to that. So Olivia, I believe you have our email addresses. We can certainly follow up with you on that too.
Yeah. So yeah, I've been working with Olivia, and I'm really happy to do that. I also want to say that I'm not sure that our outcomes as of yet can conclude that this has really helped with timely permanency in terms of qualitative information, quantitative, I guess I should say. So, we've only been doing this we only did the pilot for a year in mental health and a year in child welfare. And so pulling them together, pulling that data together, and whether or not it has impacted timely outcomes and permanency for youth. First of all, our evaluation really didn't have the funding to follow it long term, and wasn't part of our initial evaluation project. However, anecdotally, a lot of our pilot sites have said that it is really helping with that, and they're really using it to boost up their plans. So Olivia, I'll get back to you offline, okay? Are there any other questions? So it doesn't look like we've got any other questions. I want to just end with that NTI has been very successful in increasing the capacity of our field to address the unique issues of foster, adopt, kinship, guardianship families. And again, a lot of that anecdotal information is available through our evaluation reports, the testimonials that we have online, and so on. We really hope this presentation has piqued your interest in utilizing NTI in your work. We'll keep this contact slide up for a few moments, and if you have any questions, please do feel free to email either info@adoptionsupport.org, which goes into our general mailbox. I'm Maynard@adoptionsupport.org. Edna is Edna_Davis, is Davis_Brown@adoptionsupport.org. And thanks, Gary, for putting that in the chat box as well. Thank you so much for participating today. We look forward to seeing you and hearing from you, and hopefully participating in our next 2 workshops as well.
Thank you.
Thank you to Bonnie. We really appreciate you being here and are really happy that we could incorporate your learning into our learning.
Absolutely, and I am more than willing to share directly with anybody if they would be interested in talking more about how Oklahoma did that.
And I wanted to remind everybody, you will get a link to the recorded version of this webinar, as well as a link to the slides. So all that information will be available to you. And thanks so much for participating today.
Thanks, everyone. Have a great day. Stay healthy.